And welcome. My name is Melissa Ockert, and I'm Dean of Health and Wellness. I also teach in our clinical trials program. I've been at Durham Tech a long time, almost 21 years, and it's a great place, and we're just so glad to have you with us for this very unique open house opportunity. So first, to give you a little bit of background, we have just a wealth of programs, and that ranges from short-term opportunities to associate degree opportunities, and many things in between. And what I think makes Durham Tech really special is that we serve two tertiary care hospitals. We're the only community college in the state that serves two major hospitals in their service area. So Duke Health and UNC Health, of course, are major clinical partners of ours. We send many of our students to those locations for clinical and field work. And we take very seriously the fact that we are preparing our students to go into those opportunities because obviously very, very important work being done in our community. I always encourage students to ask about financial support. Even if you don't qualify for financial aid, there's scholarships, there's funding for short-term training opportunities. So never be afraid to ask for, funding for any opportunity, no matter what you do. Health and wellness programs start at different times of the year. Most of our programs begin in the fall semester, but many begin at other times as well. And it's important to know that many of our health and wellness programs do have special criteria for acceptance, including TEAS test or other competitive admissions steps. So it's really important that as soon as you can, connect with the admissions counselor for that program, or with the attend an information session for that program, so that you can learn the different criteria, different admissions requirements for each of those programs, because it might be a little bit different from some of the other areas. And we're also proud that most of our programs lead to a credential that you have to test for. So a certification, a state licensure, and that's great because it makes you more marketable, and it means that you've met a level to practice in whatever particular field that you chose. So that's really important to us, and our programs do very, very well on their exams. I always like students to sort of think about what their goals are. Are you looking to do some short-term training that's going to get you into a field fairly quickly? Are you looking to do a diploma? Are you looking to do an associate degree? And so diploma, certificate, a little bit of shorter time, usually 12 to 18 for certificates, 36 to 48 credit hours for a diploma. That's about 3 to 4 semesters or so. Associate degree is going to be a little bit longer, 5 to 6 semesters. And then the associate degree is going to include those general education courses. And it's generally the associate degree that you can also use for transfer. And we have a lot of wonderful transfer opportunities from our programs, even if it's, from nursing to lead to the BSN, or to other programs that lead to bachelor's degree. And so certainly we can answer some of those questions for you if you have them about what those next steps look like. But I always like to talk about too our short-term training, our non-credit. I believe one of the FAQs talked about non-credit versus credit programs. And these are short-term training opportunities, typically range from 129 to 324 total hours for the course. They often lead to a marketable credential or certification. Most of them require clinical, just like a degree does. And those clinicals happen at Duke and UNC and our other clinical partners. So, and lead to wonderful jobs as well. Generally, those programs have fewer admissions requirements. Generally, that's a certain level on an English or math, for example, or a high school diploma and a high school diploma. And it doesn't lead necessarily to a diploma or a degree, but could certainly be a pathway to one. The other thing I like to sort of help students think about to frame is the type of area that you might be interested in. And so I've sort of taken a minute to divide the programs out into areas that may be of interest for you. So for example, in nursing, many students are interested in coming in nursing, don't realize that we have many options for nursing, nursing assistant, practical nursing, that's a diploma. You can see the little directory there of what the degree or program is. Associate degree nursing that leads to the registered nurse credential. And then we have an LP and a practical nurse to RN program as well. If you're excited about working in the operating room, lots of options there. We're very proud of Anesthesia. Our Anesthesia Technology program is a new program that we started in partnership with UNC because of a need that they saw in their area. Central Sterile Processing is a short-term training program. We have a wonderful apprenticeship with UNC Health for that program, and surgical technology. And we're going to talk a little bit more about these programs quickly in a little bit. Several of our programs are in direct patient care. Now, sometimes people in healthcare don't necessarily want to work with patients. So we're going to talk about those options in just a second, but many want to work with patients. And we have several wonderful programs that do that. So nursing, of course, that we just talked about. Medical assisting, we offer diploma and a degree, and medical assisting is one of the fields in our area that is so needed. UNC Health and Duke say that they need hundreds medical assistants over the next 5 years. So if you're really wanting to get a job, that is the place to be. We'll talk a little bit about that. Occupational therapy assistant, respiratory therapy, which I know you've heard so much about with COVID and the importance of the respiratory therapist role in treatment of patients with COVID. And although not in health and wellness, emergency medical science, EMS, you've heard of EMTs. If you're interested in that field, be sure to go over and check out the other area where they're going to be talking about that. But we always like to mention it here because it's absolutely considered a health field. We also offer some things, a career in sort of a different setting. So we offer dental lab technology. We'll talk a little bit about that. Opticianry, farm tech, that might be a little bit different than what you're thinking about. I always encourage students to sort of think outside of the box, think about your interests, and it might lead you somewhere a little bit different than you expected, which is exciting. For people that may not want to work with patients, but want to work in, significant healthcare fields where there's huge need, we have Clinical Trials Research Associate Program. We were the first, and we're still the only community college in the state to offer the Clinical Trials Research Associate Program. As we've been hearing about research on COVID vaccines and the FDA, that's exactly what we teach our students to do, is to work in the area of testing medical products for regulatory review. Related to that is clinical data management and also medical product safety. We also have health information technology. So if you're interested in medical coding or electronic health records. And these are all fields that if you love technology, but you don't necessarily want to work with patients, but want to go into healthcare, these are all great areas for that. We also have a wealth of our short-term programs, and you can see the list here. I won't read to you, but all of these programs lead to a marketable credential and are really fantastic places to get a job and then to sort of start your career if you decide that you want to continue along a pathway. So let's talk really quickly. I'm gonna really abbreviate some of this just in interest of time because I want to give you some time to ask questions. Anesthesia Tech works right next to the anesthesiologist and the anesthesia care team to ensure safety of patients that are undergoing anesthesia. And if you go, let me say this as a side note. Please go into our booth, our chat booth, and you can come over there and ask questions. You can also pick up a number of documents about these different programs, admissions checklists and things that will give you a little bit more information since we're going so fast here. I talked a little bit about clinical research, again, teaching students how to conduct research on medical products in preparation for regulatory approval. This area is one of the foremost in clinical research in the world. A real hub. We've got biotech and pharmaceutical companies and what we call contract research organizations that do that work, not to mention Duke and UNC that conduct these trials as well. So really great opportunity, huge need in the area for that. Dental lab technician. This is one of those really unexpected areas that if you're interested, particularly if you're interested in an area like dentistry, this would be huge to build your application for dental school. We teach our students how to build appliances for the mouth. So partials and dentures and crowns and bridges and retainers. Our students learn how to do this in class in a really unique area. Lots of need in the area. And like I said, major skills that would help if you're interested in dental school. A little bit about EMS here, and again, I would encourage you to go to that area to learn more about that, but certainly want to mention it. Health information technology, again, electronic health records, medical coding, big need. We're working on an apprenticeship program with Duke now, so big connection there and lots of availability for jobs. Medical assistant. The person, when you go to the doctor, the first person you see there is likely in a clinic, medical clinic, doctor's office, is likely not a nurse. It's likely a medical assistant. So think about how important that first line person is to a patient coming in to be seen by a doctor, someone that's greeted, someone that takes your vital signs, your history, your medication, that can work both in the back office with patients, but also learning some front office skills like medical coding and the like. So again, huge need in our area, and definitely when we start that program in the fall and have some spots. I'm going to skip quickly over just descriptions for nurse aide and nursing, because I wanted to have the opportunity to talk a little bit about nursing programs that we offer at Durham Tech. The associate degree nursing program leads to the registered nurse credential. It's about 22 months. That position typically works in the hospital or medical clinic. Practical nurse leads to the diploma. It leads to the licensed practical nurse credential. Typically, this role works in a medical clinic, long-term care, or other settings, but a little bit shorter. It's 3 semesters. For those finishing the practical nursing, you can go on to get your ADN with our transition program. We have Nurse Aide I and II. Those are short-term training opportunities. Huge need in the area right now. Typically works in the hospital, medical clinic, long-term care, or home health. And then there are also transfer pathways. So the AGE nursing is going to be for those students who are completing ADN but are taking courses to eventually get their BSN. So the other additional gen ed courses that are needed. And then the Associate in Arts in Nursing is a track to help students just meet the course requirements towards entry into that traditional BSN program. So lots of options there. Again, I would encourage you to come over to our booth in the exhibit hall and ask plenty of questions about these programs since we're so short on time today. Occupational therapy assistant, helping people get back to activities that they love and their daily activities after stroke or injury, working with adults, geriatrics, and children. It is considered a therapy profession, and we have a wonderful program here at Durham Tech. Opticianry, another one of those really interesting programs that you would not think about, but for those of you who wear glasses and you go to the eye doctor and you work with someone that helps you with fitting, helps to make sure you have the right prescription, helps maintain records and that sort of thing. Wonderful opportunities in our area for this. That's what the optician does. We have an optical shop right here. Well, not here, but I'm at home, but on campus. And our students have access to low-cost eyewear that come right from what our students are doing in the lab. So really amazing hands-on opportunity. Pharm tech working right beside the pharmacist to help prepare those medications, and working with the pharmacist to help with patient education, another big need. We teach students how to work in a commercial setting, but also a hospital setting. So lots of valuable skills here, lots of need in our area. Respiratory therapy, again, we talked a little bit about that, helping patients with breathing and cardiopulmonary disorders, working closely with the physician. We have a wonderful program here at Durham Tech that it would be great for you to consider. And then finally, our surgical technology program, again, creating a sterile environment for surgery, and helping the physician with getting the instruments. Our students have to know hundreds and hundreds of different instruments for surgery. They have to build those trays. So imagine how many surgeries there are, and having to build the correct instrument tray to be able to assist the surgeon in passing the right instrument during the surgery. So lots of great opportunities here. UNC and Duke both are building, have built new surgical centers and suites. So growing need for surgical technologists as well in our area. So just want to tell you some opportunities, learn more, go to the exhibit hall and ask us lots of questions. Go to our website and look at our programs and pathways, and you can get a lot of information there. More information about information sessions and when they're occurring. Most of our programs do require an information session. So you'll want to see those pages for that. To learn more about our short-term training options, the email is there if you're by paper and you want to jot down that email, cealliedhealth@durhamtech.edu. And again, that's for our short-term training options. And then if you're just feeling, oh my gosh, she talks so fast and what the heck, you can certainly jot down my email and I can get you to the right place. I'll get you to the right program director, to the right admissions person, and we'll get you started. But again, so that's the presentation. We're so glad again to have you with us. I'm going to stop sharing and I'm going to try to get some questions from you. I see that there are a few. Oh, okay. So I love someone saying that they love the musical posters behind me, and I didn't have time to set a professional background. So I'm glad that you like it. Yeah, we're sort of a musical theater family here. The presentation, yes, will be available where the sessions are being recorded. And so you are absolutely welcome to get to those recordings and do that. I'm also happy to provide the presentation if you want to email me, and I can certainly do that. I see a fellow coworker. Hello, Ms. Hines, and I'm so glad that you could join us tonight. And send them on to our booth. We do have a nursing instructor with us in the booth, and they can answer any questions that you have. We're going to be sort of tag teaming that, but they're there to help you as well. What other questions do you have for me tonight? I don't see anything else in the chat per se. Let's see. Yes, so the question is, do we have any high school dual programs? Yes, we do. We have several CCP career and college CCP programs, career and college promise. I'm sorry, I'm still like a little crazy right now, for health and wellness. The challenge for most of our high school students has been scheduling. So because some of the programs, if they're on a block schedule or whatever, it's hard for them to make some of the classes. So what we try to help students with is get into those CCP pathways where they're getting a lot of their general education done. So getting their anatomy and physiology done, for example, or even getting in that nurse aide class. And those are very doable. And so students come in with those general education programs done. But we have CCP pathways for most of our programs. Probably the most flexible in terms of timing, like our nurse aide, our clinical trials. We've had some students that did, we've had one student do medical assisting, but for the most part, it's the schedule that's a little bit challenging. So please reach out to us specifically. Feel free to email me, and I can give you a little bit more. Or Ms. Hines, that's on the chat here, is one of our CCP experts and can sort of tell you what I'm talking about. Again, about getting those high school those gen eds done before you join us. Yes, so sharing the presentation, yes, absolutely. So the presentations will be available via recording after, and you can hear that anytime. And I'll see Adam is with us as well, and so he's putting a link here for the information sessions. And you can also email me, and I'll send you the presentation, and would be happy to do that, and can send you some other information. Do go to the booth and put in your swag bag. Information about our programs. We've got several checklists. We've got a listing of all of our programs in the pathway, including our transfer options. So that list is there too. So you just go to our booth. I think you can also go to resources and put those items in your swag bag. The presentation's not there, but if you email me, again, I'm happy to do that. I'm going to put my, I think, yeah, Mr. DeSantis put in the information session link. If y'all are still on, if y'all could put the regular CCP link there, that would be great. I'm going to put in my email again in the chat. And again, feel free to email me with questions that you have, and I can send you my yeah. And Mr. DeSantis is saying to check out the CCP booth. And so that's a really great idea to go and do that and learn firsthand about the CCP options that are available to you. I'm not sure if I can easily get to that. What do I do here? Let's see. I minimized my video accidentally. Let's see. Here we go. What other questions do folks have? Again, my email is in the chat. Again, think about the different, there's so many different options. So many of our students come to us and they say, you know, I want to be a nurse. And it's because that's sort of what you think of when you think of health programs. You think of nursing, you think of being a doctor, but so many amazing opportunities. And the focus right now really in healthcare is on those support positions. I just had an email, or just had a meeting with Duke Health the other day, and they were talking about how important these support, just answering a question specifically, these support positions are. So nurse aide, medical assisting, don't discount some of those opportunities, because there are amazing jobs there, and so many opportunities. And you can even use that as a stepping stone to next steps, even make them pay for it while you go do it. So so keep those other options in mind, and again, use us for a resource. Feel free to email me. I'll get you to the right spot.